I'll never forget Mrs. Johnson. She was 75, a retired teacher, who walked into my office holding back tears. "Doc, I haven't gone in 6 days," she whispered. She was bloated, uncomfortable, and terrified that straining would give her a heart attack. That fear isn't irrational. Every year, older adults end up in the ER because of something as simple as constipation. But here's what I told her that day. What if I showed you a technique that gastroenterologists, the real colon experts, use on themselves when they're stuck? And what if it works in less than 5 minutes? That's what we're going to talk about today. Because if you've ever felt that heavy, stuck feeling, you need to know this. Let's get real about what constipation actually does to your body over time. It's not just uncomfortable, it's dangerous. When stool sits in your colon too long, water gets reabsorbed, making it harder and harder like concrete. You strain, and that straining spikes your blood pressure, raises your heart rate, and can trigger a stroke or heart attack in someone with underlying risk. I've seen it happen. The numbers are stark. About a third of adults over 60 deal with chronic constipation, yet fewer than half mention it to their doctor because they're embarrassed. That's a shame, because the longer you wait, the worse it gets. Fecal impaction, hemorrhoids, anal fissures, and even diverticulitis. Most people reach for over-the-counter laxatives, but those can create dependency. Your colon stops working on its own. So what's the real answer? You have to understand how your digestive system actually moves things along. Your colon is like a long tube of muscle that contracts in waves, peristalsis, to push waste forward. But as we age, those contractions weaken. The nerves that signal your brain to say time to go get sluggish. And the pelvic floor muscles, which help coordinate the push, can become tight or uncoordinated. So you end up with this traffic jam. Most doctors will tell you to drink more water and eat more fiber. That's important, but it doesn't solve the immediate problem. There's a mechanical fix that acts fast, and it's something I learned from a gastroenterologist colleague, Dr. Harris, over coffee one morning. He said, "Sam, I teach this to all my patients, but most primary care docs don't know about it. I use it on myself when I travel." That got my attention. Over my 28 years in family medicine, I've learned that the best tricks often come from specialists who see the same issue every day. Gastroenterologists deal with constipation constantly. They know that the colon responds to physical stimulation, deep breathing, and the right position. But they rarely share this protocol in a way that regular folks can do at home. Today, I'm going to show you exactly what Dr. Harris taught me, and I'll explain the science behind every step. This isn't woo-woo. It's based on anatomy and physiology. Let me break it down. First, understand the geography of your colon. The ascending colon goes up on your right side. The transverse colon crosses your abdomen from right to left, and the descending colon goes down the left side, ending at the rectum. That's your waist highway. Massage needs to follow that direction. Now, here's the 5-minute protocol. Step 1, empty your bladder first. Step 2, lie on your back with your knees bent, feet flat on the floor. Place a rolled towel under your lower back. This tilts your pelvis forward and relaxes the abdominal muscles. Step 3, apply a warm compress or a hot water bottle wrapped in a cloth to your lower abdomen for about 2 minutes. Heat relaxes the external anal sphincter and increases blood flow. Step 4, with your 3 middle fingers, start at your right lower quadrant, just above your hip bone. Make small, firm, circular motions, moving upward toward your rib cage. That's the ascending colon. When you reach the bottom of your ribs, move across to your left side. That's the transverse colon. Then downward on the left side. That's the descending colon. Use steady, moderate pressure. It shouldn't hurt, but you should feel a deep sensation. Repeat this pattern 3 times. Step 5. After the massage, take 5 deep, slow belly breaths. Inhale through your nose, letting your belly expand. Exhale through your mouth, contracting your abdomen. On each exhale, gently press into the lower left abdomen with your fingers. The breathing stimulates the vagus nerve, which tells your gut to get moving. Step 6. Sit on the toilet with your feet on a small stool so your knees are above your hips. That's the squatting position. Take a few more belly breaths. In many cases, you'll feel the urge within a minute or two. Why does this work? The massage physically stimulates peristalsis. The heat relaxes the muscles that tighten up when you're stressed or anxious. The The deep breathing activates the parasympathetic nervous system, your rest and digest mode. And the squatting position straightens the rectoanal angle, removing the kink that makes passing stool difficult. It's like straightening a garden hose. Most people have no idea that angle exists, but it's the main mechanical reason people strain. When you squat, that angle straightens out and gravity helps. The combination of these factors can trigger the gastrocolic reflex, the natural signal that happens when you eat or drink. And that reflex is strong enough to produce a bowel movement within minutes. I've had patients tell me they were skeptical, but after one session, they couldn't believe how quickly it worked. Now let me address a common question. How hard should you press? Think of it like kneading dough. You want a deep, steady pressure, not digging in with your fingertips. If you feel pain, you're pressing too hard. You can also use a tennis ball or a massage tool, but your hands work fine. Another tip, do this first thing in the morning after drinking a glass of warm water. The water helps hydrate the stool and triggers the reflex. And if you're prone to constipation, you can do this daily as prevention. It takes only 5 minutes. By the way, if you want to track your bowel habits and see what works best for you, I recommend using a simple health tracking tool that I use with my patients. I've put a link to it in the pinned comment below. It's a free app that lets you log your frequency, consistency, and any symptoms. I find it helps people notice patterns, like which days they need extra water or when they've been too sedentary. It's not a replacement for medical advice, but it's a great way to become more aware of your digestive health. Let's talk about proof. I had a 68-year-old man named Robert who came to me after prostate surgery. He'd been constipated for weeks because of pain meds and nerve changes. He couldn't take standard laxatives because of his medications. I taught him this technique. The next week, he came back with a big smile. Doc, it worked in about 4 minutes. I couldn't believe it. He now does it every morning and hasn't needed a laxative since. That's not a fluke. A 2018 study published in the Journal of Gastroenterology and Hepatology found that abdominal massage combined with breathing exercises significantly improved bowel movement frequency and reduced straining in elderly participants. Another study from the University of Michigan showed that positioning, specifically the squatting posture, reduced the time needed for bowel movements by nearly 2 minutes. These are real numbers from real research. The trick isn't just anecdotal, but here's what most people get wrong. They push. Pushing is the enemy. When you bear down, you collapse the rectum and close off the passage. That's why straining actually makes things worse. The trick I just taught you works by letting the muscles do the work, not by forcing. If you try this and it doesn't work immediately, don't get discouraged. It can take a few tries for your body to respond. Also, make sure you're well hydrated and eating enough fiber. But even with those, this technique can be the extra nudge you need. Now let me give you a few bonus tips to make this even more effective. First, combine the massage with a warm drink. Coffee is great because it stimulates the colon directly, but any warm liquid helps. Second, try adding a magnesium supplement at night. Magnesium citrate is a natural stool softener that works gradually. Third, walk for 10 minutes after meals. Movement helps peristalsis. I tell my patients, if you can't do the full massage, just do the belly breathing with heat and the squatting position. That alone can trigger a bowel movement in many people. The key is to create a routine. Your digestive system loves consistency. If you do this same 5-minute ritual every morning, your colon will learn to respond. Let me circle back to Mrs. Johnson. After I taught her this technique, she called me 2 days later. She was almost in tears again, but this time from relief. She said, "I feel like I got my life back. I can go to breakfast with my friends without fear." That's what this is all about, keeping you independent, comfortable, and active. Constipation doesn't have to steal your quality of life. This simple, doctor-tested trick can put you back in control. If you found this video valuable, please hit subscribe. I share practical, evidence-based health tips every week that you won't hear from most doctors. And if you haven't already, check the pinned comment for the health tracking app I mentioned. It's a small step that can make a big difference in how you manage your health. Thanks for watching. And here's to moving freely and feeling great.